everyone, welcome back to Shannon Veronica Know Everything. Today we're going to be going over the 4 primary headaches. So that includes cluster headaches, tension headaches, migraines with aura, and migraines without aura. So we're going to go ahead and move down to our paper here. So to begin with, we have the tension type. So these are usually bilateral, and that's going to be a big giveaway, especially in vignettes, because the other ones are going to be unilateral. Also, it's going to be tight and kind of band-like in character. And these are non-pulsating. This is another distinguishing factor because you're going to find pulsating with migraine specifically. They're usually mild to moderate, and there's a possibility of them developing into a headache or migraine. And you usually find that these patients have no nausea, vomiting, and it's very rare for them to have aura. Aura meaning that there's something that's prodrome occurring prior to the headache actually happening. As far as treatment for this, you're going to use meds. You can also use lifestyle modifications, so like icing, heating. They can get massages. You can counsel them on rebound headaches because these patients typically are taking a lot of over-the-counter meds. Again, rebound headaches usually occur with patients taking over-the-counter more than 2 times per week. So now we're going to move over to migraines without aura. So these again are typically unilateral. As I mentioned, the tensions are bilateral. And these have pulsatile quality, so just that really throbbing type of headache. They are associated with nausea and vomiting. They also have light and sound sensitivity. They are moderate to severe, and they can be debilitating, so it's really hard for these patients to get up in the morning, to go to work, to go to school. The onset is usually seen in late childhood or early adults, and it's often triggered by something like food, caffeine, stress, exercise, or a lack of sleep. Headache diaries are really useful in these patients because they kind of let them know like what is the trigger for these, and that would allow them to use like meds to prevent it from occurring. So now we're going to move down to migraines with aura. So the migraine itself is very similar to what we mentioned above. The difference here is the aura. And again, I mentioned aura is something that lets you know that the migraine is going to be coming on. So for example, you could have a visual aura. So these patients see like flashing lights. They have different patterns that might be associated to their vision prior to the headache. Or they may just have like distorted vision and then the migraine occurs. There could be auditory aura, so they start to hear a buzzing sound prior to the migraine. They could have tactile aura, where they kind of get a physical sensation letting them know that the migraine is about to occur. And then those patients who have migraine with aura have increased risk of ischemia stroke. These patients also cannot have oral contraceptives, so the estrogen itself really affects the aura, so you want to keep that in mind when you have patients who are coming in for birth control. As far as treatment goes, you want to do abortive therapy, and then there's also preventative to prevent recurrence. And we can go into the meds a little later in another video. You also want to consider preventative treatment in these patients if you find that they're having 2+ a month that are debilitating, that are lasting after 3 days. So that means that when the migraine occurs, they are debilitated for 3 or more days. So they can't go to work, it just lasts forever, it doesn't go away. Or if you find that they're taking their medication 2 times a week, at that point you want to reconsider and maybe get them some preventative treatment. So now we're going to move over to a cluster type. So as far as tension and migraines, those are typically found more in females. With cluster though, you typically find these more in males and females, and it's usually around the age of 25 to 50. So cluster is a short headache, so it only lasts about 15 minutes, but it can go up to 180 minutes. And they're episodic and chronic, so kind of that cluster, meaning that they're having very frequently, so you can have like 15 minutes and then it goes away and then it reoccurs again. These also have been described as suicidal headaches, so it's kind of like having an ice pick to the head. They're just really severe, they're unilateral, and they're always on the same side, so that's something to keep in mind. So maybe somebody comes in and says, it's always on my right side and it just never goes away, just every 15 minutes it's occurring. That'd be a cluster headache. They're often retroorbital, so meaning that they're behind the orbit of the eye, and they have ipsilateral symptoms that are including lacrimation, so meaning like tearing. They have rhinorrhea, they have ptosis of the eye, facial sweating, and it's ipsilateral. So somebody comes in and kind of explains this headache that's like on and off. They're having a runny nose, they're having tearing just on that one side. You're going to want to go ahead and think about a cluster type. And the treatment here is kind of interesting. Oxygen therapy has been found to be really useful in these patients along with meds. So thanks for tuning in today, and we'll catch you next time.